Imagine this. You're sitting alone at home, watching TV or reading a book. Suddenly, it feels like a heavy weight is pressing on your chest. Your left arm goes numb. You can't breathe. You're having a heart attack, and there's no one around. This terrifying situation happens to more than 380,000 Americans every year, and most of the time, it's when they're alone. One major study found that if you know exactly what to do in the first 60 seconds, your chance of survival rises by 73%. Yet sadly, 89% of people over 60 don't know the correct steps to take when a heart emergency happens, and no one is there to help. This knowledge gap is a critical issue that we absolutely need to address together. In this video, I'll show you 7 simple science-backed steps, all verified by cardiologists and emergency experts from Johns Hopkins, Mayo Clinic, and Harvard. One of these steps is so powerful that ambulance dispatchers are now trained to guide people through it over the phone. And no, it's not just about aspirin or regular medicine. Before we start, comment your age and where you're watching from below. We read and reply to every comment. Your experiences and insights are valuable to our community. All right, let's begin. Our first crucial step, tip number 7, is to prepare an emergency communication system. Start by writing down your full address, including apartment number, your phone number, and any door codes on a bright-colored card. Stick this card near every phone in your house. Next, set 911, or your local emergency number, as speed dial number 1 on all your phones. When your hands are shaking and every second counts, one simple press can make all the difference. Always keep a fully charged phone within reach, even at night. Did you know that 43% of heart attack deaths happen between 10 p.m. and 6 a.m.? This is often when phones are charging in another room, out of immediate reach. Invest in a medical alert device and wear it all the time, even in the shower. Many tragic incidents occur simply because people took their alert device off to bathe. Also, give a trusted neighbor a spare key and ask them to check in if something seems wrong. If you live in an apartment, inform reception or security staff so they can assist emergency crews in getting in quickly. Our next tip, tip number 6, is about the cough CPR technique. It's important to note, this technique only applies if you are still conscious and only for certain heart rhythm issues. It does not replace calling 911, which should always be your first priority. At the first signs of distress, take a deep breath, filling your lungs completely. Then, cough forcefully, as if you're trying to clear your throat from deep in your abdomen. Repeat this every 2 seconds. Deep breath, strong cough. Deep breath, strong cough. How it works is fascinating. This forceful cough increases chest pressure, which helps maintain temporary blood flow to your brain. This can keep you conscious for up to 90 seconds. Crucial time to call 911 or reach your life-saving medication. This technique is a temporary bridge, not a solution. Learn and practice it in advance. You won't have time to Google it when a heart emergency happens. Knowing this by heart could be a game changer. Moving to tip number 5, the correct aspirin routine. If you're not allergic to aspirin and your doctor hasn't forbidden it, chew 325 milligrams. That's 1 regular tablet or 4 baby aspirins. Immediately if you suspect a heart attack. Do not swallow it whole. Chewing helps aspirin absorb faster, about 12 minutes sooner, which significantly reduces the risk of a large blood clot. If you're taking blood thinners like warfarin, always ask your doctor ahead of time what to do in an emergency. Keep non-coated aspirin in all the places you spend time. Your bedroom, living room, and even your car. And remember, check the expiration date every 6 months to ensure it's still effective. Tip number 4 focuses on the cardiac relief position. If you suspect a heart attack, do not lie flat. Instead, sit upright at about 45 degrees, supported by a wall or pillows. Keep your knees bent and your feet on the floor or bed. This position eases the heart's workload and makes breathing much easier. If you feel dizzy or faint, lower yourself slowly. Don't collapse. If you must lie down, lie on your right side with your left knee bent. This helps breathing and prevents choking if you vomit. Also, loosen anything tight around your neck or waist: collars, belts, ties. Keep the room cool and well ventilated. Open a window if you can. And avoid wrapping yourself tightly if you're sweating, as this can trap heat and worsen discomfort. Our next life-saving technique, tip number 3, is controlled breathing, specifically diaphragmatic breathing. When we panic, we tend to take fast, shallow breaths, which actually makes things worse and increases anxiety. Instead, use this simple breathing method. Inhale slowly through your nose for a count of 4, making sure your belly rises, not just your chest. Hold your breath for a count of 4. Then, exhale slowly through pursed lips, as if you're blowing out candles, for a count of 6. The benefits of this controlled breathing are profound. It increases your oxygen intake, slows your heart rate by 10 to 15 beats per minute, temporarily lowers blood pressure, and can even reduce coronary spasms. This isn't just for emergencies. Practice this diaphragmatic breathing for 5 minutes daily. This way, you can use it instinctively and effectively when it's truly needed, without having to think about the steps. Tip number 2 is about ensuring help can reach you quickly. Unlock doors and signal for help. At the very first symptom, if you can, go straight to your door and unlock it. Many victims collapse before they can get up again. If possible, leave the door slightly ajar. Hang something bright on the handle, like a colorful scarf, or turn on all the lights in your home to help rescuers spot your residence quickly, especially if it's dark outside. Consider installing an outdoor lockbox with a spare key and registering the code with your local fire or EMS department. If you live in an apartment, call 911 first, then alert security or the front desk so they can guide the ambulance in without delay. Keep a whistle near your bed to blow if you lose your voice and need to alert someone. Also, post your medical info sheet, including your name, medications, and allergies, near the entrance. This helps emergency teams act faster and more effectively. Our final, but incredibly vital, tip number 1: immediate action with nitroglycerin. Important: only use nitroglycerin if your doctor has prescribed it and you've been instructed on its use. Never self-medicate with it. Also, do not use nitroglycerin if you've taken erectile dysfunction medication, like Viagra or Levitra, within the last 24 to 48 hours. Combining these can cause dangerously low blood pressure. Always carry a card listing your medications in your wallet. To use it, sit down, never stand, as it can cause dizziness. Place 1 tablet under your tongue. Do not swallow it. Let it dissolve completely, which usually takes about 20 to 30 seconds. You may feel a tingling sensation or a mild headache. That means the medicine is active. Now, set a 5-minute timer. If your pain doesn't ease after 5 minutes, take a second tablet. After another 5 minutes, if symptoms persist, take a third tablet and call 911 immediately if you haven't already done so. Never take more than 3 tablets within a 15-minute period. For storage, keep tablets in their original dark glass bottle, away from light and heat. Replace them every 6 months, as they lose potency. Keep bottles in familiar spots, beside your bed, in the living room, or your car. For the best results, if you're not allergic, chew aspirin first, then use nitroglycerin as prescribed. This combination works more effectively together to address the heart attack symptoms. Remember, these methods are designed to buy you precious time until professional help arrives. They do not replace comprehensive medical care. Always consult your doctor before carrying or using any emergency medication. Practice and preparation are truly what help you react correctly when it really matters. Your ability to act quickly and knowledgeably can be the difference between life and death. These tips could literally save your life or the life of someone you love. So please, print this guide and keep it somewhere visible in your home. Practice the breathing exercise for 5 minutes daily to build that muscle memory. Check your aspirin, nitroglycerin, and alert device every month. Make it a routine. And most importantly, share this video with an older friend or family member. You never know whose life you might save by spreading this vital information. Now tell us, how old are you and where are you watching from? If you or someone you know has experienced a similar situation, share your story in the comments below. Your personal experiences might just save another life in our community. If you found this video helpful, don't forget to like, share, and subscribe to Happy Grandpa 69 for more health tips made just for seniors. Thank you for watching. Stay safe and be prepared today.